Once the diagnosis is made, if ATTR is the amyloid protein, then the first thing we have to do is, okay, is this genetic? Is it familial? Or this is what we refer to as wild type, meaning it's random. So there is a genetic test we do to see if the ATTR protein is associated with a genetic mutation. And if it is positive, the genetic test is positive, then we have to go through counseling the patient, counseling the family, testing the family to see if other members of the family carry that genetic mutation, which then will heighten our awareness and will flag those patients to be carefully followed. So if they were to manifest symptoms and signs of the disease, we can jump on them and treat them preemptively and make sure that they benefit from it. Once the diagnosis is established, then the treatment essentially consists of the following strategies. One is you want to make sure that the amyloid protein is stabilized. So we call it TTR stabilization. So the reason this is important is amyloid protein, if it is stable, it is harmless to the body. Only when it becomes unstable, misfolded, is when it causes devastation and damage to the organ where it is deposited. So stabilizing the amyloid protein can prevent further damage to the organs. However, that doesn't take away what has already been deposited before. So it does prevent decline and deterioration, but doesn't necessarily take away what has already happened. So there are several drugs that are available now to treat. These are TTR stabilizers, and we have shown that these drugs can improve symptoms, they can improve the quality of life, and they can also improve survival in patients who have TTR amyloidosis. The second class of drugs are what we call TTR silencers. So we know that TTR protein is produced in the liver, so we turn off the switch, so it's no longer produced. So that is the silencer. And TTR silencer drugs are available. 2 of them are actually approved for TTR involvement of the nervous system. We are currently undergoing clinical trials to see if these drugs are beneficial to people who have involvement of the heart. And then the third category of drugs are still investigational. And these category of drugs look to see if we can remove the protein that's already been deposited in an organ. Can you get rid of it? Can you isolate it and somehow extract it? And this way it's removed from your body. That is still very investigational. We hope to have some more drugs in the future as the results of these trials become available. Now, for the other type of amyloidosis, amyloid light chain amyloidosis, the light chain is produced in the bone marrow, and the cells that produce this light chain are called plasma cells. So this is a plasma cell disorder, and there is another plasma cell disorder that's well known among hematologists, which is called multiple myeloma. So the drugs for this particular disorder are generally chemotherapy drugs, and also bone marrow transplantation is known to be effective for AL amyloidosis. Breaking it down by the type of amyloidosis, the outcome is different. So if you have AL amyloidosis that is either missed or not diagnosed or not treated, the life expectancy is 6 months. It's devastating. It's like cancer. It's a very high mortality rate. ATTR amyloidosis, if diagnosed and untreated, the life expectancy is 3 to 5 years. And now, if you look at it from how about with treatment, what sort of improvement can you expect? So AL amyloidosis with treatment, life expectancy exceeds 5 years. And ATTR amyloidosis with treatment, life expectancy can be as long as 10 years or more. So diagnosis, appropriate diagnosis, nailing down the precise amyloid protein which is affecting the condition, and recommending the right treatment based on that finding is critical to getting the best outcomes in this condition. At Allegheny Health Network, we have a cardiac amyloidosis program. We also have all the diagnostic tools that are needed for the diagnosis of this condition. So this is a condition where you really need a team. because there are so many aspects to the diagnosis of amyloidosis, not to mention the treatment and the follow-up that is needed based on the diagnosis. This is a condition that requires everyone's contribution to really get the best outcome. So we have a wonderful cardiac amyloid team here, which has allowed us to be highly successful in managing these patients and making sure that they are all benefiting the most with the available therapies. And finally, we are also on the cutting edge of research. We continue to evaluate investigational drugs and other investigational diagnostic techniques to improve our ability to make early diagnosis and also get more effective treatments so we can continue to improve the lives and outcomes of people who suffer from this condition.